I'm Dr. Grainne Gorman, an honorary neurology consultant and clinical lead for Move Lab, which is Newcastle's exercise, physical activity and performance laboratory. I have an interest in exercise as therapeutic intervention in mitochondrial myopathy and currently assessing its role in both mitochondrial disease and age-related muscle disease. The focus group I led was looking at fatigue and its impact in patients with mitochondrial myopathy. The areas discussed were 1. What is fatigue? 2. With regards to patient-directive management. And the third aspect was interactions with professionals and their ability to either understand what fatigue is or also to help. Coming to the first aspect, what is fatigue? Well, there was quite a spectrum of aspects of what fatigue meant to each patient. Descriptions included feeling wiped out, having totally no energy, feeling extremely drained. The consensus within the group, it wasn't just everyday tiredness, that it was a most severe and debilitating form of lack of energy. And perhaps that's the aspect which we focused on during the discussion. The bits that patients found quite difficult was its impact on everyday activity, such as struggling to perform their everyday tasks, such as holding down a job, or simple things around the house. It wasn't just about the ability to perform activities, it was also about ability to commence activities. So for example, for one woman, it was extremely difficult to do simple chores within the house. She was unable to use the vacuum cleaner and very much relied on her partner. The second aspect, which we looked at, was self-directed management. And the outcomes of this were as follows. 1, that patients paced themselves and found this extremely helpful, so therefore they planned their day. 2 was energy conservation measures, including the use of wheelchairs when required. And the third aspect was resting when required. The last aspect of this focus group was very much looking at patients' interaction with health professionals, their understanding of what fatigue was, and what their understanding of what mitochondrial disease was. And perhaps this generated the most discussion. The consensus among the group was that health professionals really don't understand what mitochondrial disease is and really do not appreciate the severity of fatigue that's associated with it. It was felt that from GP level right through to other health professional levels, that really the concept of mitochondrial disease was quite lacking. The group as a whole felt that further education was essential of all health professionals. It was advised that education should begin in medical school and should continue throughout training of all doctors, irrespective of seniority. And patients felt that really this was probably the most important thing that they would find helpful, because quite often as they meet GPs or in different clinics, that they really have no understanding of the diversity of symptoms, irrespective of just fatigue, that they may encounter, and felt that this was probably one of the greatest barriers during their exposure to healthcare professionals. So just in summary, I would like to say a sincere thank you to all the patients who were involved, not just in the patient day, but also in the fatigue focus groups. This was extremely beneficial, I feel, hopefully for the patient, but also for ourselves, and gives us direction on where we need to focus the next aspects of our research. To date, quite a lot of you have been involved in research with particularly fatigue, but I think for myself it's given me direction where we need to target the next step and next aspects of our research, which is very much to incorporate education as well as delivery of research. So just to say thank you to you all for your participation on the day and for your previous help in the past with research.